We're going to move on to a question that comes from Rita, who is also joining us via Skype. So Rita, what is your question? Thanks for being with us.
Thank you. I've been suffering with tinnitus for a long time now, and I've been dealing with it, and it's been affecting my hearing, and I asked my doctor about it, and he said there was no cure for it. So I was hoping maybe you would have some idea what I could do, or is there something out there that can help me?
Well, that's a great question, Rita. You can either say tinnitus or, as you said, tinnitus. Both are correct. And what it is, it's a subjective feeling of either buzzing or ringing in the ears. And in fact, we have an example that I want everybody to hear so they can get an idea of how devastating this can be if you're constantly listening to a sound like this. So Rita.
Yes.
I need to ask you a few questions. So you said you've had this for years now?
Yes.
And was there any history of a specific trauma or other diseases or medications that you took that may have started this process?
Not to my knowledge.
Okay, and you say that it's affecting your hearing. Are you aware that you've lost some of your hearing?
It seems like as I've gotten older, yes.
All right. Are you having any problems with dizziness?
Sometimes I do, yes.
Okay, well, you know why I ask? Because the inner ear is involved with both balance and hearing. And, you know, the hearing part, something goes wrong there with that inner ear and you develop this tinnitus. So those things being said, you know, what you need, number one, before we talk about a definitive treatment, is a little more workup. You need to see a specialist, check your hearing, and then they're going to go from there. If they rule out anything serious going on, they're going to talk to you about things such as diet, other medications, and possibly doing what we call masking, where you actually use a hearing aid and they present you with a certain sound that will mask the ringing in your ears.
Okay.
And Rita, because this is so individualized, we set you up with Dr. Thomas Higgins at Kentuckiana ENT for a consultation and hearing test to help determine the cause and put you on a treatment plan that's right for you.
How's that sound, Rita?
Thank you. That sounds great. Thank you so much.
Be well, Rita. Thanks so much.